The Born to Move project is a project that I've been passionate about as a health visitor. It's been my baby since 2009, and the project has been developed in partnership with the children's centres and health visiting teams to promote parenting from birth and to help parents learn more about what they can do to support their child's healthy development. There have been 3 key messages. The first important message was that babies need awake tummy time daily, but it's very important as an early movement skill to develop core strength and to strengthen the muscles in their arms, legs, back and neck before they double in size by 4 months. And in our experience with the project, when the babies have had this opportunity to play, they're much more likely to go on to crawl. And crawling has been found by one of the big research projects in the country to be one of the predictors that children will reach their developmental milestones by the time they're 1. The other 2 key messages are that chatter matters, so encouraging parents to talk to babies from birth and listen to them and encourage interaction so that the babies build up a wide vocabulary and learn to talk. And our aim is that we can then reduce the number of children needing speech and language therapy. And the third key message is that eyes need to move too, because there has been a tendency in this modern culture, of busy lives, that babies are entertained and educated by screens more and more. And actually their eye muscles are quite immature when they're born, and babies need to be encouraged to watch moving objects so that they develop their eye muscles at the side of their eyes, so that their eyes develop tracking skills to follow moving objects. And this is vital for when they start school so that they can track words across a page.
I found the project really useful. It's not something I'd heard of, and she loves tracking the dog and watching his movements and the noises that he makes. And she loves playing with different things, and you can really see the change in her over quite a short period of time.
Born to Move and Clean and Dry Ready for School, which is a project where health visitors and school nurses support parents to toilet train, have both received national recognition by the Department of Health and are in the top 20 innovative projects in the country. It's a great time to be a health visitor. I've been health visiting for 25 years, and now we have the opportunity, funded by the government, to develop innovative projects. Kent is on target to recruit more health visitors, and we're scheduled to reach our target of 342 by 2015. So if you are interested in coming to work with children and families that are really helping to make a difference, now's the time to join.
We wanted to find a way to support young people and their families to make healthier choices together, and for them to understand how this helps to maintain a healthy weight as they grow up.
Establishing good habits early in life can help set the foundations for future health.
Anyone tried tzatziki dip before? It's like a Greek dip, okay, so that'd be a new thing.
The Ready stage of the course introduces families to the basic concepts of healthy eating and how to encourage their physical activity in a fun way.
We're going to make, I really don't know how to pronounce that. Tzatziki, and this is Greek, fat-free Greek yoghurt.
What's your favourite kind?
Red peppers.
The peppers?
Yeah.
After completing the Ready phase, they then move on to the Steady phase,
Find a breakfast cereal low in sugar and fat,
where a 6-week programme builds on messages such as the Eat Well plate and activities including Beat the Budget and food labelling, as well as continuing with regular exercise sessions. The Go phase of the course is about families taking their newfound knowledge and moving forward with confidence to a healthier future.
We've been talking to patients, and we know that one of the things that you want to do is receive care much closer to home. And one of the areas that we've really been working on is during the winter, when we know that if you have an urgent care need, again, it will be really good to provide that care to you close to home or within your home if that's possible. So one of the areas we've been working on is developing our intermediate care services, and particularly the rapid response element of that intermediate care service, which means that we can have a team of clinicians visiting you within your own home within a 2-hour period to assess what your needs are and to then put in a care package around that. so to prevent you actually going into hospital, into an acute hospital. Of course, we've also got alternatives with our community hospitals as well, where you could actually go into a community hospital bed and receive some rehabilitation as well, if that's actually what you need. We've been very fortunate for this winter period coming forward. The CCGs have recognised how important these services are, and they're actually investing in developing them and putting in a more enhanced model. So we're really excited about that development for us. We're on a journey towards Foundation Trust status, but we're absolutely committed, whether we're talking about a new service development or an ongoing service, that the quality of their services and the focus on the quality of our services is absolutely paramount. And I'm convinced that all of our staff within the organisation, both from those delivering care at the front line to all of those that are hidden behind in the corporate services, are absolutely on board with that message and working very hard towards improving and continually striving to improve the quality of our services.
I'm a domestic supervisor, and I'm in charge of the other cleaners that work here, and our job is obviously involved in keeping the cleanliness of the hospital. We've got really high standards, and we like to clean the hospital like we would our own house.
I think the whole premise behind being a matron is ensuring that standards and quality are always maintained, and it's about, you're the guardian of safe care and the guardian of patient safety.
My name's Andrew Kirk, and I've been on Sapphire Ward for 4.5 months. I am suffering from a condition called Guillain-Barré syndrome, which means that the nerves are attacked and your muscles don't work. So when I arrived here, I was on a stretcher and couldn't move pretty much anything. I don't think I'm clever enough to actually put that into words. All I can really say is that I am privileged to have been allowed to stay here until such time as I'm allowed home, hopefully walking, that's the plan, and so that I can actually look after myself when I get home. It's the simple things. Somebody's always there to make a joke, give you some encouragement. I don't have the words to actually describe the privilege it is to be in a ward like this. The first time I walked, I didn't actually realise that I was walking until I was halfway across the gym floor. Hospitals make you better, but Sapphire makes you whole again.
I have made a difference to individuals. There was a young person, he was terminally ill, he was only in his 40s and that. And we laughed and we joked, and I made his last few days really, really happy. And when his friends used to come in, they used to get on the weighing scales as well. And then he went home, and obviously he passed away. And his brother came in to see me one day. I spoke to staff nurse and I actually asked for time out. I felt that he needed just to talk to me in private. And he explained he'd just come back from a funeral. He sat and cried with me, and he actually said that I made the last days of his life memorable, and he would always remember me. And I was so grateful for that, you know, because it's nice to know that you've made a difference to someone. Because hopefully somebody will be there for me one day.